Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Verapamil, or Isoptin as a brand name. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe Verapamil to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. Then discuss examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So verapamil hydrochloride is an L-type calcium channel inhibitor. It selectively blocks the transmembrane influx of calcium ions into arterial smooth muscle. It causes vasodilation of peripheral arteries and reduces vascular resistance. In terms of indications or reasons we would prescribe verapamil to a patient, we may see this medication used in hypertension or high blood pressure, as well as in chronic stable angina or chest pain. Aside from stable angina, it can also be used in unstable angina, as well as variant angina. Patients with atrial fibrillation or flutter may use this medication. And finally, patients with supraventricular tachycardia may also use verapamil. With respect to contraindications or reasons we would not be able to prescribe this medication, we wouldn't give this medication to patients who had cardiogenic shock. As well, patients with a hypersensitivity to verapamil or any other component of the formulation would not be able to use this medication. Patients with atrial fibrillation or flutter associated with accessory bypass tract would not use this medication, as well as patients with severe left ventricular dysfunction. Patients with second or third degree heart block or AV block, atrioventricular block, would not use this medication. And finally, patients with sick sinus syndrome without a pacemaker in place, this would also be a contraindication. Now for some examples of dosing with verapamil. So we're just going to go over the treatment of hypertension and go over some different dosage forms and what those doses are. So using the extended release tablets, the initial dose would be 200 milligrams orally once daily at bedtime. The patient could titrate as needed at 100 milligram intervals to a maximum of 400 milligrams once daily. If they are using the sustained release formulation, they may use 120 to 360 milligrams orally daily as a single dose or in 2 divided doses. If they are using the immediate release tablet, the initial dose may be 80 milligrams orally 3 times daily. They would adjust based on the response to the medication, and the maximum dose would be 480 milligrams per day. Again, this would be divided throughout the day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using verapamil, so we'll go over some of those here now. 3 to 6% of patients may experience dizziness, while the headache may happen 2 to 12% of the time. 1.5 to 3% of patients may experience hypotension or low blood pressure, while up to 4% may experience edema. Constipation may happen 7 to 13% of the time, and sinusitis may happen 3% of the time. Some patients may experience influenza-like symptoms. This seems to happen about 4% of the time. Now, some more serious side effects would be atrioventricular block, a myocardial infarction or a heart attack, and finally, pulmonary edema. All right, everybody, that's all we're going to talk about today with verapamil or Isoptin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you thought the information was valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.